Thanks for tuning in to part 2 of hormone replacement therapy or a natural hormone replacement therapy. If you listened to part 1 or viewed part 1, you know that we still have a lot of territory to cover. And why would I be doing this today? Because I believe that many women are pretty much dropped off the face of the earth. They're kind of dropped off of the bridge. They're told, well, you have all these symptoms. This is what you should do. Yet you have many concerns. We know that much of the literature shows that synthetic and animal-based hormones leave with them a slew, an area of potential problems. So today I'd like to continue to define for you in the part 2 segment here of natural hormone replacement therapy. And we define what we termed as natural. And all I really feel with natural is that you're talking about a non-synthetic based, non-animal based. We defined that already for you in part 1. If you haven't watched it, go back. And why we feel that's not compatible. They are hormones and chemical structures that are absolutely not compatible, not identical to what your body produces. So why would I be comfortable in recommending that you put them into your body, whether it's my wife or my daughter or a patient that we work with? We should only put back what my body would make. Identical structures, absolutely, positively identical. Let's go back a little bit deeper. Natural, derived from a yam, soy source, converted in a lab, 1 to 2 steps to mimic exactly what your body makes. We talked about saliva hormone testing to define how low your levels are to make sure that you are in need of them. Number 2, to do follow-ups 2, 3, 4 months down the line, and then maybe a year down the line to make sure that the numbers are in what we would consider relatively safe ranges. We talked a lot about estrogen in that first one and why I felt that we needed to do a part 2, because part 2 we'll talk a little bit about progesterone and testosterone and why they're really important. Progesterone was first thought to be important to just protect the endometrial lining of women that were on hormone replacement. So many times women are told by their obstetricians that they don't need progesterone because maybe they've had a hysterectomy. And they have no need to protect that endometrium because you don't have one. The reality of it is progesterone performs tremendous physiologic activities and properties. Just to name a few, it is a counterbalance to estrogen stimulation. Estrogen stimulation would mean that if estrogen activates estrogen or hormone receptor sites, if it's not counterbalanced, if I have all estrogens, no progesterone, I have excessive stimulation. Therefore, female hormone receptor sites are hyperactivated, hyperstimulated, creating potential problems, or hyperplasia, or rapid, out-of-control growth of that tissue. So hormones can be stimulatory to tissues, to hormonal sites that have high receptor activity. So why is it important to use progesterone? Whether you have an endometrium, whether you've had a hysterectomy or not, partial or full, because progesterone counterbalances estrogen dominance. That might affect your thyroid hormones, because if your thyroid hormones are not functioning well, it could be as a result of estrogen dominance, whether it is your own body producing estrogen dominant situations, or that you're taking a hormone estrogen only prep and not using progesterone to counterbalance it. Progesterone is bone trophic. There's literature that supports that progesterone is bone trophic, meaning that it stimulates osteoblasts. Osteoclasts break down bone, osteoblasts build bone, stimulate new bone formation. So osteoblastic activity are critical. So progesterone plays a key role there. So progesterone needs to be a part of, we believe, of this complex. If your testosterone is deficient, that should be evaluated as well. Why? Testosterone is associated not only just with maintaining libido for a woman, but also with bone mass. The literature documents that low testosterone levels are associated with declining levels of bone health and bone activity. So that should be evaluated. So this is not just about sex drive, testosterone, but it is also about bone health as well, cardiovascular health as well. The next question devil's advocate would be, well, but isn't this whole process, menopause, a natural progression? Why would you be interfering with it? Well, we're not interfering with it. And yes, it is a natural progression. It's a God-given process. But what we find is that some women, many women, just do not transition through this phase well. Don't sleep well, have incontinence issues, more anxiety, more depression, even heart palpitations and rapid heart rates are even associated with this vaginal drying, loss of libido. I covered those in part 1. So all we are proposing that we do via our support in helping you and educating you here and then helping you make the transition is to, in essence, help you transition. Is it forever? Should you do it till you're 85, Lord willing? You live that long? No. Should it be for a period of time just to help you transition? Possibly. Well, why don't I just use synthetic or animal-based? I covered that in part 1. Why I don't believe that they're the safest options. Oh, so then these are perfectly safe without potential downside? Didn't say that. We believe that we can term them God-approved, not FDA-approved, God-approved. We know that there are differences in estrone, estradiol, those estrogens. We know that they have different levels of activities. Some are more stimulatory, some are less stimulatory. We know the progesterone counterbalances estrogen stimulation. It not only protects the endometrium if you do have an endometrium still in place, or if you don't, there are still health benefits. We know that they are neuroactive substances. There's literature that supports that progesterone can even help and aid sleep processes and sleep mechanism. Actually just pulled an article just recently showing that progesterone can actually be utilized to help a woman sleep. So there's probably, that we know of, dozens of different mechanisms of which I can't cover in short little teaching segments like this. Now, would you use a synthetic or would you use a biologically equivalent to what your body makes? You would use a progesterone. We know that literature supports that the synthetic versions carry with them, for example, breast tenderness, more anxiety, headaches, fluid retention, stimulation to breast tissue, etc. And maybe I'll do a part 3 and give you specific documented evidence for those of you that would be doubting Toms. And you don't want to take my word for it. I don't want you to take my word for it. What I speak from is from literature that documents it. So maybe there will be a part 3 to this segment that'll strictly be the scientific evidence that backs up and clarifies what I've laid out for you. So your options are to then incorporate a biologically equivalent or biologically identical to what your body makes progesterone to go along with your, quote, estrogen type compound. Testosterone, if necessary, should be a part of that. Why? Bone health, libido, vaginal wall health, even associated as well with bladder type health, etc. So I think just following this process, why would we consider hormone replacement? Who's a candidate? What type? What form? Let me clarify one final area. Why I believe that transdermal preps, it's not perfect, most closely mimic what your body does. Transdermal bypasses first pass metabolism, which is a oral prep, means it goes to your liver first. Transdermal does not. It goes right through your skin, goes into the circulatory system, occupies receptor sites, and then is brought back to the liver to be broken down and handled. We believe, and there's literature that supports this, I'm going to do probably a part 3 and document this for you, much safer option to go transdermal as opposed to oral. Folks, I didn't even identify myself at the beginning of this program, but Joe DiMatteo of the Len and Joe Ask the Pharmacist radio broadcast. You can reach us at lenandjoe.com. You can reach us via toll-free number at 877-275-7743. I encourage you to go to our website at mscompounding.com and look at specific literature, mscompounding.com, specific literature that will document some of the areas that we've covered here with you. God bless. Have a great day.